Welcome back to the Diabetic Foot Files, the podcast where we talk about all things foot health for people living with diabetes and those who can care for them. I'm your host, Dr. Gia. Just call me Gabby. And today we're going to dive into a topic that might seem small, but it also leads to some big problems toenail fungus. I have a quick side story when it comes to toenail fungus. So, as a student, maybe third year, you start doing clinics. And clinics, most of the times, they just let you clip people's toenails. And people come in to the podiatrist because they usually do have thick, discolored toenails. And I'm a talker when it comes to patients. I like talking to them and getting to know them. And one time, which taught me a very good lesson to maybe keep my mouth closed or, have a good shielding tactic when it comes to clipping toenails. I was a student, third year, clipping a nice lady's toenails. They were thick and long. And I'm talking and laughing with the patient. And then one clip, I can't even remember which toe it was, but that thick toenail went straight down my throat, like straight down my throat. Not even on my mouth, but straight down my throat. Like, didn't even give me a chance to swallow. And after that moment, I realized I was stuck in podiatry for the rest of my life. I was like, well, nothing we can do now. That's it, And I didn't want to make the patient feel weird about it. I was like, oh my gosh. But, I didn't want her to feel like I was disgusted by it. But nothing happened to me, which was a good thing. So, yeah. But after that, I was pretty much committed to podiatry for the rest of my life. So let's get into it. So, nail fungus. It isn't the easiest cocktail party conversation, but so much people, when they hear that I'm a podiatrist, they talk about toenail fungus. So, but if you're managing diabetes, it's something that deserves a little bit more attention than the average person. Fungal toenails aren't just a cosmetic issue, but it also is a diabetic issue that could be the first domino effect in a chain reaction to a serious infection or even worse. So, what is toenail fungus? Toenail fungus, it's a condition, what we call medically onychomycosis. Actually, I don't know how many times I've said onychomycosis, but I'm pretty sure either dermatologists or podiatrists are the ones who can go in the Guinness Book of World Records for saying onychomycosis for an entire lifetime, like as many times in the world. So it happens to be a fungi, usually dermatophytes, that infect the nail bed, the nail plate, or even both. And what would be the result of that type of infection? A thickened, discolored, yellow, brittle toenail that may lift off the nail bed or crumble at the edges, which seems very familiar. But sometimes it becomes very thick and dystrophic. What she called dystrophic means it's lost its shape. It's very abnormal shape. And it also has what we call subungual debris. You have to remember to put that in your chartings, like, thick and discolored toenails with subungual debris. That's very helpful. It helps also when it comes to reimbursements. And so now the fungus thrives in dark, warm, moist environments. And where is that? That's usually when we're wearing socks or shoes. And then when you combine that with sweaty socks, tight shoes, and a compromised immune system, which many diabetics have, that creates a perfect storm. So why is fungus a big deal when it comes to diabetes? Let's break it down. 1, poor circulation means that the body's defense system don't reach to the feet as effectively as it should. 2, reduced sensation. Thanks to peripheral neuropathy, people can't stop and notice the small problems that become big ones. Like I said, the heel fissures, the athlete's foot. Some people even get athlete's foot in between the toes, that nice white maceration, and it will eat away to the bone. And the people don't feel it. They just notice some type of drainage once it passes those skin layers. And 3, fungal toenails can break through the skin, like I said, create a point of entry for the bacteria because our skin is filled with bacteria and cause fast-track cellulitis or even a diabetic foot ulcer. And I'm not trying to scare you. I'm just trying to raise awareness. But the good news is toenail fungus is very treatable and also, more importantly, preventable. I've heard so many home remedies from different patients, and it is quite interesting. I've heard fix, soaking in apple cider vinegar, and I'm not saying these work. I haven't experienced these myself, but it's very interesting to hear the different home remedies that exist. I've even heard somebody say about using a dilute solution of bleach once a month and letting your foot soak. Please don't ever do that. Please don't ever do that. Please just go to the podiatrist and we can figure out a better treatment plan that's best for you. And the other thing is, you should also do a nail biopsy. That should be one of the biggest things when you go to the podiatrist. They should do a nail biopsy to check if it actually is fungus, because I think about 75% of the time it is fungus, but a little bit less than 30% it's not fungus. Sometimes thickened toenails are caused by like chemotherapy or psoriasis or other skin conditions, or even internal medical issues like systemic problems. So keep that also in mind. Sometimes it's not just fungus. Also, another thing that can cause the nail dystrophy, often, especially if it's only on one toenail, I always ask the patient, hey, did you hit it in the past? Did you have a history of trauma? Are you a soccer player, an athlete, things like that? And they will recall, hey, yeah, this one time something dropped on my toe, or I hit or what they call buck my toe against the bed. And yeah, that's because they cause trauma to that nail bed, and the nail bed that produces those cells are are abnormally aligned and affected to the point where they don't produce a nice flat single layer of a nail plate for them. So what do I recommend? Good nail hygiene is non-negotiable. Everybody should go to, especially if you're diabetic, go to your local podiatrist to get your toenails trimmed straight. You don't cut the corners, you do it straight. Podiatrists can do something called a wedge resection, but let the podiatrist do it, not the pedicurist, because sometimes they cut the cuticle and then that causes cellulitis. And a lot of times I get a lot of patients that come in with ingrowns because they went to the pedicurist and they were trying to remove like a little bit of a curve, and then it actually does cause an ingrown to worsen. Also, wear breathable shoe wear. Keep your feet nice and dry. If you're sweating a lot from your socks, change your socks often. I also say use the athlete's foot spray or powder, a nice absorbent powder. Another thing that you can use for sweaty feet is antiperspirant wipe that is prescribed for sweaty feet. And I know also they use Botox now and then. So those are multiple options. But as a diabetic, I always try to keep it nice, simple, and the remedies that have been used for many years that I can trust and I'm not expect much side effects, such like mitoconazole powder, clotrimazole, cyclopirox. Those are things. Cyclopirox is a prescription strength antifungal. And yes, there's oral medications when it comes to treating fungus. A lot of patients are interested in that, but you have to get what is called a liver function test. And you actually are supposed to get the liver function test 3 times: before the treatment, in the middle of the treatment, and after the treatment. So the oral antifungal treatment, is about 3-month course, and it's really hard on the liver. So if your liver functions are high, we do not recommend, and it would be not standard of care to allow you to take an oral antifungal for 3 months. If your liver functions are not good, you're not going to take it, okay? If your liver functions are within normal limits, then we will prescribe the first half course of the 3-month course. So we're going to prescribe the first 45 days. Then within the 45 days, in the middle of the treatment, then we're going to get another liver function test to see if the first half of that oral treatment affected your liver or not. If it affected your liver to the point where you're out of range, then we're going to stop the treatment. If it didn't affect your liver and you're still within normal limits, then we're going to continue the other half of the oral antifungal treatment, okay? And yes, after that, you're going to get another liver function test. And then if everything's good, then you're good to go. But now here's the other thing. I always tell patients, which is something that a lot of patients are not aware of. How long do you think it takes to treat toenail fungus? Maybe 3 months, 6 months? No, it takes a whole year, because we're not really treating the toenail that's actually fungal. We're treating the nail that is going to grow from the nail bed and root, the new nail, so that it becomes non-fungal, okay? Because that's what the fungus is doing. It's repeatedly infecting nice, healthy, new nail plate. So that's why you're going to have to wait an entire year, because it takes an entire year to make a whole new nail plate, okay? And so what will also happen, you'll see something called a line of demarcation. And the line of demarcation is the line that separates the fungal toenail to the healthy non-fungal toenail. And so you're pretty much going to grow it out, kind of like growing out a split end. You're going to grow out the toenail fungus until it's completely on the edge, okay? And then I know the option of laser antifungal, but it's not covered by insurance because it has not been FDA approved that it literally treats and gets rid of onychomycosis for 100%. So it's best to keep to the treatments that your insurance could possibly cover, because it also shows that they've done enough clinical research to show that it's 100% effective to treat toenail fungus. But if you notice that, oh yeah, maybe it's been a year, maybe 6 months, or even 8, and there's no improvement, and you haven't done a toenail biopsy as yet, you should do a toenail biopsy. But when it also comes to toenail discoloration, if there's something looking off, you might need to refer the patient to a dermatologist, because you want to rule out also melanoma, okay? You want to rule out any other skin conditions that could be also contributing to it, okay? Because there are some times that, yeah, this nail looks a little odd and iffy, and it turns out to be something, mm, not to scare anybody, but we just want to rule out any type of cancer. So also regular foot exams. I always tell patients, most of my diabetic patients that are low risk and you come in for routine foot care, you see the podiatrist every 3 months to get your toenails clipped, okay? And don't ever skip them, okay? We're always going to fit you in. So a quick word about over-the-counter products for fungus. Don't expect any miracles. Please be patient. And compliance, compliance, compliance. What is compliance? You follow the instructions. I always tell my patients, the people that I see the best success with topical antifungals when it comes to treating toenails are my geriatric patients, the patients that are senior citizens that have a home health aide that follows the instructions daily. They have a home health aide that literally follows all these different instructions, possibly doing wound care, or lotion their feet every day, but also apply the antifungal solution or cream to their toenail every day. Those are the patients I always see, wow, your toenails are becoming non-fungal within about a year. So wherever you are, either if you're a patient, a caregiver, a medical professional, remember, healthy toenails aren't just cosmetic. These are clinical. Toenails are supposed to be protective, and in diabetes, it could be a part of a bigger picture in your foot health, okay? So thanks for tuning in to the Diabetic Foot Files. If you found this episode helpful today, please share it with someone who needs to hear it. And don't forget to subscribe. And we got more evidence-based foot care talk coming your way. Until next time, take care of those feet, because they take care of you. And also stay fungal free.